Hey friends, welcome to Embracing Your Season. I'm your host, Paige Klingenfield. Thank you so much for joining me today. I'm at the AACC National Conference in Dallas, Texas, and I have an amazing guest joining me on the show today. Her name is Dr. Shawnee Anderson. Dr. Anderson is a distinguished licensed clinical psychologist and a renowned trauma expert. Upon completion of her PhD, Dr. Anderson created a cutting-edge program for those struggling with trauma, substance abuse, and eating disorders. She is currently the clinical director of Monarch Recovery Intensive Outpatient Program in California, as well as the director of psychology at the American Association of Christian Counselors in Virginia. Not only does Dr. Anderson support those with complex issues at her private practice, she also invests in the up-and-coming bright minds by serving an adjunct professor of doctorate of psychology program at Liberty University. But during my conversation yesterday with Shawnee, one thing that I learned is that she has an adorable granddaughter that she loves dearly. And so we get to have an amazing conversation with her today. So make sure you stay tuned to after the show for some of my takeaways. But let's get my conversation started now with Dr. Shawnee Anderson on this edition of Embracing Your Season. Well, we are here at the AACC conference in Dallas, and we are so excited to have all the guests that we have on the show this week for Embracing Your Season. Today, I have with me Shawnee, and she is going to tell us some amazing things about forensic psychology and a little known personality disorder that you probably are friends with in some capacity at some point in your life. And so, Shawnee, thank you so much for joining me here today.
Thank you so much for having me.
How many people ask you first about the forensic psychology? Because that to me is super fascinating.
It's really funny. That seems to be what most people are interested in.
I know.
Because I'm a clinical psychologist and a forensic psychologist, and I've been in private practice for over 25 years clinically. But I did do training and my doctoral internship in forensics and kind of touched on it for a long time, but really got more into it in the last decade or so. And so for people to understand what is a forensic psychologist, forensic means that it's associated with the legal system. So there are a whole host of ways in which you can be involved in forensics as a clinician. So for some individuals, they actually might work in a hospital and work on people, let's say, who are there because they're gravely disabled or a danger to self or others, and they have to actually work with the legal system if they need to keep somebody in the hospital against their will longer. Sure. That's one example. Another example is doing child custody evaluations for families that are going through divorces. Yes, I would never want to do that. I actually got trained in my doctoral internship at Arizona State Hospital and was working with victims who were claimed not guilty by reason of insanity.
Oh, wow. Interesting.
And so that was a lot of what I was doing in addition to other forensic labels. But that's really where I got my training. And I was very blessed to be trained by a psychiatrist who really worked under Dr. Park Dietz. He is kind of one of the really big forensic psychiatrists in the field. And my mentor was Dr. Stephen Pitt, who worked on the John Benet Ramsey case in addition to other cases. So I was very blessed to have some wonderful training by him. And so I was planning to go into forensics full time and then got actually assaulted by a patient on one of the units. And so that kind of put a little damper in my spirit on that, but really got back into it in the last 10 years. And so I usually get hired by attorneys to evaluate their client. And because one of my specialties is trauma and PTSD, that's really where I focus my time and attention, is that I will evaluate people, determine if, in fact, they have a diagnosis of post-traumatic stress disorder, and was it involved in the commission of their crime, and how that might factor in terms of guilt, non-guilt, It ties into also sentencing, different things like that.
Oh, absolutely. I know people have asked us as clinicians, how do we hear some of the hard things that we hear? But from the forensic perspective, you're dealing with people who have committed crimes in big ways. So how do you deal with that in your day-to-day?
I think one of the hardest things for me, being a primarily clinical psychologist, is I get brought in usually to do the evaluation. I'll write up my report. I may testify in court. And then I have to let them go. And I have the heart of Christ. I love to just help people. That is really what I want to do. And so it's very hard for me to let them be, because you're right. I hear horrible stories of, women who were just battered and abused by their husbands, who they finally, at the end of the day, essentially couldn't handle it anymore and retaliate, and hearing these terrible stories. And for me, I don't like that sense of feeling so helpless and powerless, that I wish I could continue to work with them, because I do develop a relationship with them through the assessment process. So that's actually been the hardest part. I think God has given me a very unique ability to hear the worst of the worst stories, because, again, specializing in trauma, I have heard horrible things over the years, and the Lord has just, I think, given me an ability to just immediately turn it over to Him. And He's given me very big shoulders to carry it, and I think probably because I do give it to Him.
What a blessing. And thank you for doing that. I mean, truly hearing those stories and having that heart of Christ, as you said, to want to help people. Like, we just need more people like you in the world. So thank you for doing that.
Thank you. Well, the funny thing is, I never wanted to even go into this field. My bachelor's degree was in a whole different arena. I was pre-med. I was exercise science, physiology major, was going to go to medical school. And then God, as He does, allowed certain trials in my life to happen. And then things kind of shifted, and He said, I'm calling you in this direction. And thank God He did, because it is so very clear that this is where I'm passionate. This is where I know I'm doing His work.
Yeah. And what a good reminder for those out there, maybe the listeners right now. It's like, you're on this path, but God is directing your steps. So keep that in mind. May not be the season where you saw yourself going, but God is going to use that in a huge way. And how beautiful that is, that He is the one over our story, and we don't always get to choose. Which, I mean, if I chose my own path, I would not be where I am today.
Right?
Like, He did it so much better than me. So praise God for His sovereignty in that. So let's switch gears. Let's talk a little bit about a diagnosis again that is maybe not widely known. I mean, we know as clinicians, I talk about this a lot, but we hear a lot about narcissism. We talk about relationships like that and toxicity, but there's one that you actually have a specialty in. I would love to hear more about that.
Well, the diagnosis is borderline personality disorder, and it is the diagnosis that when clinicians hear it, we look in each other's eyes.
I'm triggered by you just even saying it, because when we brought it offline, I was like, oh, girl, let me tell you the story when I was a chronically mentally ill social worker.
Oh, yeah.
I mean, everyone.
Yes.
Oh,
it is. What I think is interesting is that we are in this culture right now, which I do think is highly narcissistic. Don't get me wrong.
That's right.
But I do think that there is a lot of misdiagnosis of people that actually may have more of a borderline personality disorder instead of narcissism. But if you go back, borderline personality disorder was originally, I don't know if I could say created, but was originally identified as the borderline between psychosis and neurosis.
Wow.
So it goes way back to psychoanalysis, that there was this group of people who really had a difficult time being psychoanalyzed, because if you're lying on a couch and you can't see your psychoanalyst who's sitting behind you and you're not getting any feedback, these individuals would have almost psychotic episodes.
Wow.
And they didn't know how to fit them in to the rubric that they had. And so they just said they're just kind of on the borderline of both. And over the years, the personality disorder got developed and put into our DSM diagnostic manual. And I guess I'll just describe a little bit of it. If you look up the diagnosis in the DSM, it has 9 different identifiers of different behaviors that need to be chronic, and you see them in a number of different environments. And rather than going through all the different variations, because if you recognize that there's 9 criteria, there are 254 different variants of borderline personality disorder. So when I say I specialize in borderline personality disorder, 2 of my patients can look very, very different, but have the same diagnosis. And so the way I like to see them is that they really struggle with issues around identity, that there is a lot of chaos and instability around identity, a lot of chaos and instability around mood, a lot of chaos and instability around relationships, which is where I think they get the bad rap. And then lastly, chaos and instability in terms of cognitive issues. And so what happens is that what we know about the development of borderline personality disorder is that it is multivariate. There is a very strong genetic component, which for many, many years, nobody believed that that was the case. But if you have what is typically more of like a borderline mother, there is a greater likelihood that you will have a borderline child. And so there is a genetic predisposition, and what they think that genetic predisposition is about is a high emotional reactivity and sensitivity. And that a lot of times there will be children that are often just seen as having a difficult temperament. They're maybe a little bit harder to soothe. They have bigger tantrums. They're just temperamentally out of the gate a little bit more difficult. They tend to often later be classified as someone with borderline personality disorder. Wow. But that's not the whole story. So we know that there is this genetic predisposition. And Marsha Linehan wrote a book and has created a whole treatment protocol called dialectical behavior therapy. And she actually came out and said that she was herself diagnosed as borderline and created this treatment protocol, right?
For herself, let's go, yes.
Created this treatment protocol to help individuals with this diagnosis heal. And she was really the first one that came out and said, look, these individuals have a temperamental hypersensitivity, and in addition to that, they are raised in an invalidating environment. And so the term now that we're all talking about is gaslighting.
That's right. Yeah.
Basically, these children get gaslit, I never know which it is, in childhood for their experiences. And so because they are highly sensitive, if you don't have parents that are attuned to that sensitivity and they're actually misattuning and kind of gaslighting their child's internal perspective, that is really the big crux in terms of developing the diagnosis. Now, in addition to that, we know that most individuals with borderline personality disorder also have a history of trauma, and most particularly a history of sexual trauma or physical abuse growing up, verbal abuse, sexual abuse. And so I think what has happened, because sadly, individuals, and often the ones that I think tend to get the worst rap are the women. Most people think most women have the diagnosis, but it is actually a 50-50 split. Men absolutely do get diagnosed with borderline personality disorder. They do look a little different, but because we as women are more emotional and more relational, I think it's more obvious. And so what you may see if you've got, let's say, a borderline friend or family member or work associate, is it's somebody who is highly reactive. They have very poor boundaries. They take everything personal. They have tremendous fears of abandonment. They will be willing to do anything for a relationship not to end. They're highly impulsive. They engage in a lot of self-destructive behavior. Self-mutilation, the only place that it's really in the diagnostic manual is within the diagnosis of borderline personality disorder. They struggle interpersonally, they struggle internally, and it's a very, very painful existence. And so if you understand, which is where I come from and why I think I'm able to work with them, is really understanding where they're coming from, that they were born highly sensitive, born with an inability to kind of self-regulate, and then often raised in these environments where they've been abused, where they have been gaslit. And so they often will end up with that diagnosis. But clinicians don't like to give them that diagnosis because there is such a negative stereotype associated with this. When I think of borderline personality disorder, one of the prototypical examples is in Fatal Attraction. That the lead character in there initially appeared so confident and normal, and then due to the relational component, she got very desperate. She started stalking. She threatened suicide because there was the end of the relationship. Now, she ended up going off the deep end, and I think we're dealing with somebody who's more psychopathic. But what is interesting, Princess Diana is somebody that has been diagnosed borderline personality disorder. There are actually a number of people. Some people say that in the movie with Jennifer Lawrence, I'm forgetting the name, that she won her first Academy Award for, she plays somebody who's borderline. Silver Linings Playbook. Where what you see in that movie, there's a lot of a push-pull with her. Of she wants connection, she wants intimacy, but at the same time she pushes away, and she can be very self-destructive and actually destroy what she really wants. And so that's why a lot of clinicians don't like to treat it, because it's highly, highly volatile. And what happens is that an individual, you know this as a clinician, how an individual is out in the world is how they're going to be in the office with you, which is why most of my borderline patients have come from referrals of other clinicians who are like, help, I can't do this. But the Lord has been just so faithful to me. I grew up with an alcoholic mother who I think had a lot of borderline tendencies. And so I learned how to deal with gaslighting. I learned how to deal with emotional chaos and relational chaos and abandonment fears and a lot of that. So I think, in a sense, I was almost groomed to do this. And I've had a lot of my own therapy too. And so I think, again, the Lord has given me very unique skills to work with this population.
I find it fascinating that it's both nature and nurture, right? So the genetic predisposition to the hypersensitivity, and then you're raised in this environment, which again is that passing down, whether we call it a generational curse or whether it's just modeling, it's the parenting, and all of it is contributing to, unfortunately, these behaviors that are played out in time. And in reality, these people just need to be connected and loved and nurtured and
consistently.
And yes, how
and that,
to
I
live
think,
healthy.
Absolutely. That is one of the biggest issues, I think, is that these individuals were raised in chaos with a lot of inconsistency. And so they really can't trust. Another factor that's predictive of borderline personality disorder is disorganized attachment. So what we know from attachment theory is that there is secure attachment, which is when your parent is consistent, and they're not going to be 100% consistent, but they'll be consistent and loving and affirming and things like that. But that there are 3 insecure attachment strategies. And disorganized attachment is really when you have a parent that is either abusive, or we know from the research they're finding out mothers who have a history of unresolved grief, loss, or trauma, that if they don't address those issues before they have children, they will respond in very unique ways to their child. And they will either be frightening to their child, or they will be frightened by their child.
Oh, interesting. What's that about?
Well, if, let's say, you have a child or you have a mom who's got unresolved trauma, and seeing a helpless infant crying, who, sometimes we can't get those little ones to be soothed, and just the dysregulation in the child, for example, may be something that actually scares the mother. that actually seeing someone who is most likely reflecting to them exactly how they felt as a small child or when they had their own trauma or grief and loss. But without treatment, they've not had the opportunity to put the pieces together. But that's what's so amazing, is that we now know that we can tell you your attachment style years before you ever even think about having children. And if you have a disorganized attachment style because of unresolved grief, loss, or trauma, you can actually get help, change your attachment style, which then can have a huge and profound impact on your child or future children. So that's what I love about the mind. That's what I love about all of this. I studied under Dan Siegel for many years and his interpersonal neuropsychology or neurotheology. No, that's mine. Interpersonal neurobiology. And really looking at how plastic the brain is and how our relationships with each other can change it. And so it's wonderful that through healing relationships, you can change the brain, you can change the mind, you can change potential long-term outcomes that at once we thought were just stuck in stone.
So our attachment style is indicative of how we were raised. So that implies that we can't change how we respond to our environment, right? When in reality, you're saying, no, we can. Once we identify what our style was due to our childhood experience, we can do that. So what are some ways that people can first identify what their style is and move through that to health?
Sure. There are actually a number of quizzes, even online, that you can go to. I think there's even like a site like attachment.com or something like that where you can actually do a test that assesses your attachment style. And then what we do know about the way the brain works is that in those first 3 to 6 years of life are really when the attachment working models are being developed in the brain. And we know that through the consistency or inconsistency of the parent, primarily of mom, but dad matters as well, and any other ancillary figures that are there attached to the child, that those neural pathways are being laid down in those first 6 years. From about 6 years till puberty, there's not a lot of changing of those neural pathways. They're just kind of growing. And what happens most commonly is that based on our attachment style, the relationships that we create in elementary school, middle school, are often going to be very consistent with the attachment style we have to mom or dad. But the great news is that during adolescence, really at the onset of puberty, we know that the brain goes through a pruning process. So all the different neural pathways that are no longer being used will get pruned away, which can be good or bad. So it's like if you had really bad upbringing and you get good adolescent parenting, you know, the bad stuff can be pruned away. But it's often very tricky because teenagers at that time are pushing mom and dad away.
Absolutely.
And that's the time when they really can have those relationships change. And so those are the two real key times. So early infancy to about age 6, then again, from about puberty to about age 25, the brain is going through a lot of change. So those are the two times when it's probably easiest to change those. But the brain is still very plastic. Through neuroplasticity, it can always change. And that is truly what I believe goes on in psychotherapy, is that through a clinician and a patient, you develop a working alliance, you develop an attachment. And if the clinician has done their own work and they themselves have a secure attachment, or what we know as earned secure attachment that you can get from psychotherapy, but also there's research that is showing if you marry somebody and you're insecure and they're secure, which is not very common because usually secure sticks to secure and insecure is insecure. But if somebody's insecure marries somebody who's secure, that attachment style can change, research has shown, within 5 years of being married to that person.
Wow. Amazing.
As relationships change, the brain changes.
Can I tell you that I'm just super hopeful about my kids? I have 4 kids, 3 of which are teenagers. One is a preteen.
Oh, God bless you.
I remember exactly your reaction, right? Like when they were little, I don't even remember their childhood because it was full of chaos. Right? So now I'm thinking, but they're in teen years. I can make it up to them. We'll prune off all those memories, where mom was panicking in the middle of Target and I wasn't functioning, but thankful to Starbucks,
But kids are resilient.
Praise the Lord.
Yes, they are. And that's where there was this one study, and I teach this all the time, and I need to actually find the actual research study. But I know for me, when I was a new mom, I knew all of this, and I'm like, oh my gosh, I have to be attuned. I need to have a child that's got a secure attachment. And so I kind of overdid it, I think, a little bit in my anxiety. And I was so relieved when I heard this study that said, actually, parents, you only need to be attuned to your child a third of the time. That doesn't, however, mean you can be misattuned for 2/3. To be a good enough parent, you need to be attuned 1/3 of the time, misattuned 1/3 of the time. And misattunement is kind of like you snap, in Target, or, you're on the phone and you don't get to your child who needs help right away. All those moments when you're just not connecting right. You're allowed to be misattuned for a third of the time. But there's another third that I think a lot of people don't talk about, and I know for myself, I didn't even know about. And it's called repair. And it's a recognition as a parent that you're like, I'm so sorry I just snapped at you. I'm having a bad day. Will you please forgive me? And this is where that whole dynamic of attunement, misattunement, repair, is that not from the Lord?
Absolutely.
Think about it. He is always attuned to us. We're a hot mess. Misattune me. How often do we misattune? And it's like, oh yeah, God, I'll get to you later. But that he is always there for reconciliation. And he's always there to repair. And that, to me, is our role model of how to live life, how to be a parent, how to be a clinician, all of that.
That's beautiful. Wow. Thank you for that. That's a good reminder, and for our listeners as well. I would love to go back to if we are in relationships with someone that maybe struggles with borderline personality disorder. So I would say even a handful of women friends of mine that have mothers that struggle with borderline. And so they've asked me, what are books out there? How are resources? What are some of your encouragement or suggestions to them?
There is a great book. I think, sadly, it's getting close to being out of print, so it can be difficult to find, but it's called Understanding the Borderline Mother. And it is an excellent book. What I love about it is she likens the different types of borderline mothers to fairy tale characters.
Oh, fascinating.
And so she has the hermit, which is the borderline mother who's more quiet and avoidant. She has I'm trying to remember the hermit, the waif, who is the very kind of helpless victim mother. And then the third one is the queen. And that's where I think a lot of the queen mothers get misdiagnosed as narcissistic.
That's right.
But what she talks about in the book is that all 3 of these mothers, at some point in time, and this is the problem, is they're so unpredictable, turn into the witch. And that is what makes it so difficult having a borderline mother, because you don't know which mother you're going to get.
Yeah, so chaotic.
Because you may have the queen, but then you say the wrong thing and you don't even know it's the wrong thing, and she won't talk to you and gives you the silent treatment for the next 2 weeks. And I love that book because it really identifies what it's like to be raised in that environment, but she also gives strategies of how to cope with that mother when you're an adult.
That's lovely.
So that's really my favorite book for individuals that have parents or have a mother that's borderline. There is also, I believe it's just Stop Walking on Eggshells.
That's a good one. Yep.
Is kind of the book that everybody knows about. And I highly recommend it to anybody who's married to somebody who has this diagnosis, who has a friend, a parent, a child even, with borderline personality disorder. And there's a couple of things I really, really like about the book is that the book doesn't just focus on the borderline. It really has you look at your own reactions.
That's good.
And why are you taking responsibility for their explosions? Why are you walking on eggshells? Because innately, that is what we do when we're around somebody who's highly volatile, because you don't want to be on the receiving end of that. But sadly, that is the worst thing you can do.
Yeah.
Because you then almost give permission to pathological behavior. And so what is really, really important, and I do work with a lot of parents who have borderline children. I work with spouses who have borderline spouses, and then I work with the borderlines themselves. And a lot of it is communicating clearly, saying what you mean, and mean what you say.
That's good.
Because they have a tendency to try to mind read, which is called hypermentalization, that they are always in their mind trying to anticipate what you are thinking. And it's almost as if sometimes you're not in a relationship with them, because they've already figured out what you're thinking, how you're going to respond, and they're already responding to you based on their assumption of what you're going to do. And it can be kind of crazy making. And so it's really about being very concrete. I say a lot of times, you need to drop 50 IQ points and just communicate very clearly. Have good boundaries. And again, say what you mean. Let your yes be yes and your no be no.
Yeah, that's good.
And that can be hard because people with borderline personality disorder have very strong emotions. And they do struggle in managing them. And so that's where I know a lot of people are like, well, I don't want to upset her. And it's like, well, she is a grown-up and she's able to choose what emotions she's going to feel. And hearing somebody say, but she's not going to choose joy if I confront her. And I'm like, well, that's her responsibility.
That's right.
But you can also say, hey, I don't like how you're talking to me, and I'm not going to communicate with you until you speak to me in a kinder way, and be very firm and hold those boundaries.
Yeah, that's good. Wow. Well, I appreciate all the information today. Again, I think some people don't even realize they're in relationships with people like this. So giving definition, giving some strategies is truly something to help people with their next steps. So I would love people to find your information, get connected with you. Where can they find those resources?
I am kind of difficult to connect with. I do have a website. It's just drshawnee.com. I don't do much social media. That's a whole other story. But you can if you have questions, you can email me at shawnee@drshawnee.com.
Excellent. Well, thank you so much for this conversation today. I appreciate you being here. And
thank you.
Blessings on all the things that you are doing.
Thank you so much.
Friends, I had a great conversation with Shawnee. In fact, I look forward to spending more time with her and having her back on the show for further conversation. Today, some of the takeaways that we had, we were talking about some of those people that have potentially a diagnosis of borderline personality disorder, but also some of those toxic relationships that we can be in and ways that we can navigate some of those. Now, I know that Shawnee was able to talk about how majority of the people that have those mental health struggles or relationship issues come from a chaotic family. What I love that she pointed out was that we can still heal from a poor attachment from childhood. So, for instance, if you were raised in a dysfunctional or chaotic home, you don't have to live stuck in some of the coping skills that you learned from that point, or potentially even some of the identity statements that were spoken over you. You can heal and grow from that. It does require other people, professional trained counselors, wise individuals who have navigated this on their own successfully, speaking into you. This isn't something necessarily you can do on your own. You can read books, you can find articles, because of the fact that sometimes we stay stuck in the childhood trauma, the things that were spoken over us that we don't even realize have contributed to how we view ourselves today. So having others speak into us to help us grow and heal is really tantamount to changing your life as well as your relationships, and particularly in your marriage and raising your own kids. So if you did grow up in an environment like that, no, first off, you're not alone. Secondly, you don't have to stay stuck in the patterns that you learned, and you can grow and heal from the things that were even at a foundational young level for yourself. Another thing that I love that she talked about was when, as a parent, we mess up. She was talking about the cycle of the misattune, the attunement, and then the repair. And as we go through that, even the parents that are doing it super well, we do still make mistakes, right? There's a day-to-day indication that we can't always get it perfect, but the way that we respond to that imperfection, the way that we react to the mistakes that we make while we're parenting with our kids, determine how we interact not only with our child, but also shaping our child as we model for them healthy interactions. So, with the repair piece, when we recognize that we're misattuned, so for instance, Shawnee was able to talk about when we're not responding to our child and meeting their needs when their needs are appropriate, and we're busy, we're chaotic, we're frustrated, whatever it is, that we don't always meet them where they're at. That doesn't have the final say in our relationship with our child, as well as our identity as a parent and their identity as our child. So we're able to come in and actually seek forgiveness. We're able to come back and say, you know what, I did not do that well. Will you please forgive me? I'm going to try harder to do it differently next time. This has actually been super transformational with my own kids. I still practice this frequently, where I maybe had a bad day and my kiddo was asking for more screen time. Anyone else relate to that? And I'm just super annoyed at this point. And I'm like, can you not obviously see that I'm in the middle of something? So I snap back at them. Later, I'm able to go back and like, dude, I'm so sorry. I did not mean to treat you that way. I love you so much, but I didn't pay attention to you. And even though obviously I shouldn't have responded that way, I know that I can do better next time. Will you forgive me? This has been huge because now I'm also seeing my kids practice this in their own relationships. This is something that, again, can be a generational change moving forward, setting the stage for good, compassionate interactions with one another, because we are going to make mistakes. We are going to fail, but how we repair them intentionally makes all the difference. And then finally, what about those relationships that maybe they are rough, maybe they are toxic, or they're unhealthy, maybe they need to have established boundaries? Shanae talks about communicating clearly and meaning what you say. So when you make a boundary, when you take a stand and say, I'm not going to text you, or we're not going to talk about this subject, or I'm not going to come to this event, make sure you stick to that. Because the more that you waver, the more that these individuals feel like they can continue to change your feelings, change your behaviors. When they see that you're going to be pretty stuck in your convictions, they'll still continue to push, of course, but they're also going to see that you're consistent in your values and your standards, and that hopefully one day they'll start backing off a little bit more because they believe that your yes is yes and your no is no. And certainly we can teach this to our kids as well, not only in their relationships, but helping them learn their own values, standing by the conviction of their values, so that when they encounter a circumstance where maybe it does come up against their boundaries or their convictions, they're able to stand firm and know what they believe, know what they want, and know what they need, and they're able to act that out in a healthy way. So again, you are modeling for your kids. So start integrating some of this today. And when those people push those boundaries, make sure you stand firm. And if you need support from your spouse or your friends in order to stay firm in these ways, absolutely seek their reassurance. Ask them, are these boundaries appropriate? Are they healthy? Because sometimes we set things in place that maybe aren't because our own filter is skewed. So asking them to share that wisdom can also be encouraging as well as enlightening. Well, friends, I want to thank you so much for listening to the show today. If you have any feedback or guests that you'd like to see on the show, make sure you email me at paigeklingenpeel@gmail.com. We have a lot of exciting interviews coming up, so be sure to tune in again next time for another edition of Embracing Your Season.